On cruise day, most families picture ocean views and adventure, but few realize that up to half of children can feel seasick before you even spot a warning sign. When a happy child suddenly turns pale and quiet, every moment counts. What actually works to prevent seasickness on a cruise with kids? The answer starts long before you step on board, and most parents do not know the first step. Inside every child's head is a tiny built-in level sensor called the inner ear. On land, it helps kids balance and tells the brain when they are upright or moving. On a ship, things get more complicated. The inner ear senses the boat rising and falling and tilting side to side. Meanwhile, if a child is focused on a book or a screen, their eyes report that everything is perfectly still. This disagreement between the inner ear and the eyes confuses the brain. For many children between ages 2 and 12, that sensory mismatch is enough to trigger seasickness. The body tries to make sense of mixed messages, and the result is often nausea, dizziness, or a sudden feeling that something is not right. Younger kids, especially toddlers, may not have the words to explain what they feel. Instead of saying they feel sick, they might get quiet, clingy, or irritable. Understanding this simple brain-body mix-up gives parents a head start. Spotting the early signs and acting fast can make all the difference. A child doesn't always announce seasickness with words. The first signs often appear in their face and actions. Pallor is common. Their skin may look pale or slightly grey, and their lips may be less pink than usual. Repeated yawning often follows, even when they are not tired. This is not boredom or sleepiness, but a classic early warning. Clammy sweat along the hairline or neck can follow, sometimes so subtle parents only notice after touching a child's forehead. Some children start swallowing more often, or you might see extra saliva at the corners of the mouth. In toddlers and younger children, behaviour shifts are often the earliest clue. A lively child who suddenly grows quiet, wants to be held, or stops playing may be feeling the first wave of nausea. Others become irritable or whiny for no obvious reason. Older kids might pull away from group activities, complain of a mild headache, or say their stomach feels weird. The pattern is clear: pale face, repeated yawning, and a change in mood or activity. Spotting these signs early lets parents act before nausea takes over. Rest and hydration begin long before the ship leaves port. A well-rested child is less likely to feel queasy, so a quiet evening and a regular bedtime the night before travel matter more than they seem. Fatigue makes the inner ear even more sensitive to motion, and dehydration can amplify every uneasy sensation. Offer water throughout the day before boarding, and skip heavy, greasy meals in favour of something light, such as toast, crackers, or plain rice. Packing is your next line of defence. Families often find it helps to prepare a small carry-on kit for embarkation day. Inside the kit include a refillable water bottle, a handful of bland snacks like pretzels or crackers, ginger chews or biscuits, single-serve electrolyte packets, a few wipes, a zip bag for emergencies, and a spare shirt. These basics fit easily in a backpack and cover most early needs. With these habits and supplies in place, families step onto the ship with a lower baseline risk and a sense of control even before the first wave rolls in. The moment a child starts to look pale or says their tummy feels strange, parents can take action that makes a real difference. Fresh air is the first step. Heading out onto an open deck or even standing by an open window lets the breeze cool the skin and carries away any lingering food smells that can worsen nausea. Looking out at the horizon is more than just a distraction. It gives the brain a steady reference point, helping the eyes and inner ear agree on the ship's movement. This simple act can calm the confusion that triggers seasickness. For many families, moving to a bench midship on a lower deck, where the ship rocks the least, keeps the child steady and comfortable. Parents often find that offering small sips of water and a few plain crackers is easier for queasy stomachs than a full meal. Screens and books go away for now, and gentle conversation or quiet music can help the child relax. These early moves, taken within the first 10 minutes of symptoms, can prevent seasickness from getting worse and often restore a child's comfort before nausea takes hold. Many families prefer to start with non-medicine options, especially for younger kids. Ginger stands out as a parent favourite. Ginger chews, biscuits, or tea are easy to pack, and several studies suggest ginger can take the edge off mild nausea for some children. Ginger's effect is not guaranteed, but side effects are rare at typical doses, and it is best to try it at home first to check for taste and tolerance. Acupressure wristbands, often called C-bands, are another low-risk tool. These bands press gently on a spot near the wrist known as the P6 point. While research is mixed, many parents report the bands help, and they are safe to use alongside other strategies. Some families also practice slow, steady breathing or distraction techniques like listening to music. When symptoms are more persistent or a child has a strong history of motion sickness, over-the-counter medications like dimenhydrinate or meclizine may be considered. Pharmacists emphasize that age, weight and health history matter, so always check with your child's doctor or a pharmacist before using any medication. Testing any remedy at home, a few days before the cruise, is a simple way to spot side effects like drowsiness or mood changes in a low-stress setting. For most kids, layering these approaches, starting with gentle, familiar tools and reserving medicines for tougher situations, offers a balanced, safe plan. Cabin location can make or break a family's comfort at sea. On modern cruise ships, the midship area, right at the vessel's center, moves the least because stabilizers built into the hull reduce roll and keep motion to a minimum. These underwater fins adjust automatically to counteract the ship's roll and keep motion low. Families who choose cabins midship and on lower decks experience less sway, especially during rough seas or windy crossings. This is not just theory. Cruise lines and pediatric travel guides consistently recommend midship and low deck rooms for anyone prone to motion sickness. When booking, prioritize cabin location over upgrades or views. A window or balcony for fresh air helps, but the ship's physical center is the true spot for stability. For day-to-day life on board, the same rule applies. When a child feels off, head to a central lower deck, whether it is a lounge, a quiet hallway, or a shaded spot outside. This is the calmest place on the ship. To keep things simple, parents can follow a 6-line plan. A screenshot-ready checklist with those 6 steps can be a lifesaver in the moment. With the right cabin and a clear plan, families can enjoy smoother sailing and respond quickly when symptoms appear. Spot early signs such as a pale face, yawning, sweating, dizziness, headache, or a tummy that feels weird. Hydrate and help the child cool down. Find fresh air and encourage the child to look at the horizon. Move midship and to a lower deck for less motion. Offer bland snacks and avoid screens and reading when symptoms start. Use safe remedies responsibly, for example ginger or acupressure wristbands. Check age guidance and consult a doctor or pharmacist when needed. Some symptoms go beyond ordinary seasickness and need a different response. When a child cannot keep fluids down, vomiting every time they sip water, or throwing up more than 3 times in a few hours, dehydration can set in quickly, especially for toddlers. Watch for a dry mouth, no tears when crying, or very little urine over 8 hours. High fever around 102 degrees Fahrenheit or 39 degrees Celsius is a warning sign that something else may be going on. Seasickness alone does not cause a fever. If a child becomes unusually sleepy, hard to wake, confused, or complains of a severe headache, these are urgent signals. Family B had mild queasiness at first, but when their son grew listless and stopped drinking, they went straight to the ship medical center. Ship doctors see motion sickness frequently and are trained to handle these situations. Early help means a faster, safer recovery for everyone on board. If you notice these signs, ask for medical advice promptly rather than waiting. Ship medical centers are used to treating motion sickness, and getting help early protects your child and the whole family. Cruise ship medical centers are designed for quick, practical care, and they are especially focused on families with kids. On board, the clinic routinely treats motion sickness in passengers of all ages, from toddlers to teens. The medical team sees cases like these every week, not just during rough seas, but on calm days too. Parents can walk in without an appointment, and the staff is equipped to handle everything from mild nausea to more persistent vomiting. Oral rehydration fluids are stocked for children who cannot keep water down, and anti-nausea medications are available in age-appropriate forms. The clinic protocols are based on pediatric and travel medicine standards, so parents will not have to explain what is happening or worry about being taken seriously. Early visits are encouraged and are never treated as overreacting. The goal is always comfort and recovery, whether that means a cool room, a safe place to rest, or medical support if symptoms escalate. For families, knowing this safety net is just a short walk away can turn worry into confidence. Today, nearly half of children experience some form of motion sickness at sea. For families, awareness and preparation turn uncertainty into confidence on every cruise, every time. When parents act early, most cases of seasickness never become a crisis. A smoother voyage starts with knowing what to watch for. Thanks for watching.